Lily. My name is Dawn Sittler. I'm a student physical therapist at the University of St. Augustine. And based on your diagnosis and evaluation, I have a treatment in mind for you, but I'd first like to ask you a few questions and perform a few more tests just to make sure you're a good candidate for this treatment. Is that okay? Yes. Great. By chance, are you pregnant? Do you have a pacemaker implanted? Okay, great. Okay, and then because you're having a lot of shoulder pain, I'd also like to bundle it with cold. So I'd like to ask a few questions about that. Do you have history of Raynaud's or Burkitt's disease? Do you have any frostbite condition on your right shoulder? Any cold sensitivities or allergies? Do you have any severe cardiovascular respiratory problems? Did I forget any? Peripheral vascular? No. Okay, so based on all of that, I think you're going to be a great candidate for this treatment. So what I'd like to do is just inspect the skin. So do you mind removing your shirt? And bringing up just your left arm in there. Thank you for putting your hair up. That doesn't hurt your shoulder, I hope. Okay. So I guess you've had a rotator cuff repair, so I'm going to lift it for you when it is time for me to position. Okay, so I'm looking at just your skin integrity. I'm looking for open wounds, infections, rashes, any burn scars. It looks good. I'd like to just see how your sensation is. So if you could just take it away, I'm going to just touch the skin, and you just say yes when you can feel my finger touch your skin. Yes, 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 yes. So as an aside, I'm going to be placing, pretty much 4 electrodes around her shoulder. So I want to test where I'm going to be placing those electrodes especially. So go ahead and look away. So if I do one there and one there and one there. Sorry.
But also wherever the cold pack is going to be and or the hot pack when we get to that.
Great. Okay. So that looks good. So Lily, what I have in mind for you today to treat that shoulder pain that you're having from the surgery, that acute pain that you're in, is to use a little bit of electrical stimulation with a cold pack on there. And what you're going to feel with the electrical stimulation would be just a light tingling sensation, very comfortable. And with the cold pack, you're going to be feeling kind of a sequence of cold burn, ache, numb. That'll take about 5 minutes. And this is going to help reduce your pain that you're having and any spasming that you might be having in your muscles there. And that will help you to be able to sleep better and to get dressed a little bit easier and especially perform the exercises that I want to do with you. Does it sound like a treatment that you'd like to try? Yes. Excellent. And we operate on a call bell system, so if at any time you're experiencing something I haven't explained, you're uncomfortable or in any pain, or just a question that you may have for me, I want you to ring this call bell. Great. Okay, so far, so good.
Wasn't that beautiful?
That was beautiful.
Oh. I got this one.
Well done. Well done.
Okay, so soap and water would be the best, right? But I'm going to just use some alcohol swabs, okay, to get the oils off. So first thing I'm going to do is just kind of get any oils that you have on your skin off. Okay, so the electrodes conduct better because, on the side, I'm not going to explain this to my patient unless they ask. When you have oils on your skin, possibly you're going to have increased resistance, increased impedance to current flow, and so that can get uncomfortable for them. So if I clean off all those areas where I'm going to be putting the electrodes. Some people say, oh, it's better because the electrode sticks better. Well, of course it's going to stick better. I'm cleaning the skin, but the reason we're cleaning the skin is because of that impedance, okay? That's the real reason. Okay, increased impedance. So, now, for the stimulation, I'm going to do the setup and sitting, and then I'm going to have her lie down afterwards because it's much more comfortable when you're having shoulder pain to be really well supported. Oftentimes people with shoulder pain, especially post-surgical, there's usually a lot of neck pain that goes along with it. So if I've got electrodes on her and a big cold pack on her, that's going to be weighing her down, and that might even cause more neck pain. So if I can get her supine, if I have a plinth available in my clinic, I would use that when I get her set up. For the machine itself, you guys need to get used to, after you plugged in, the first thing you're always going to do is turn your machine on before you do anything else, okay? You don't hook the electrodes up until the machine is on, and a reason for that is safety again. The machine can hold a little bit of kind of charge to it. I rub my foot, I'm holding charge, I touch someone, they get a little shock. the machine can hold a little charge to it. If I hook her all up, turn the machine on, she can get a little bit of a shock from it. Okay, so as a safety, anytime you have a machine, plug in, turn it on before anything's attached to your patient. Okay. All right. Now, I do not have to have black and red because
You have the black, right?
oh no, you know what?
I thought she had
It's in your lap.
I don't.
Oh,
have-
sorry.
Oh, you know what she does?
Oh, you mean this?
Was that your right arm? You're not supposed to do that. Okay. So I don't have to have black and red. Okay. In fact, some clinics they're not even black and red. They could be blue and purple. But by having that, it's going to help you guys see where I'm putting the electrodes on her. Okay. Because the important thing is that I take 2 channels and I do a crisscross for interferential current. So on the device, it will say channel 1, channel 2, high volts. Make sure you're plugged into the correct place. Doesn't matter, black or red. I'm just going to choose randomly here.
And you can't have 2 reds and 2 blacks.
Doesn't matter.
Doesn't matter.
Doesn't matter. And this can be longer than the other one. Okay, that happens. You're going to see all those machines say, oh, why is this one so long? It just is. Okay. Okay, so I have my 2 channels set up, and I have these electrodes, and I like to get the electrodes set up first. Some people like to put the electrodes on the patient first, but it's easier for me to put them all in here and use my body to